The National Paediatric Diabetes Audit, NPDA, collects information about the care that children and young people with diabetes receive from paediatric clinics in England and Wales. This is to help services see where they can improve. The NPDA is managed by the Royal College of Paediatrics, and child health is funded by NHS England and NHS Wales through the Healthcare Quality Improvement Partnership. In 2020, the whole world was affected by the COVID-19 pandemic. This had an impact on all healthcare and made it difficult for services to see people face to face. The information collected by the NPDA over this period was published in our national report in April 2022. It showed that in 2020 to 2021, there were over 31,000 children and young people with diabetes in England and Wales. About 1 in every 500 children in the population. 95% of these children have type 1 diabetes, with the rest having type 2 or other rarer forms of diabetes. The number of children and young people newly diagnosed with type 1 diabetes increased by 20% over the 2020 to 2021 audit year compared to previous years. Researchers are looking at why this may have happened. The number of children and young people with type 2 diabetes has also increased and continues a trend of small increases each year. Children and young people with diabetes should receive a series of health checks each year to help monitor their condition and identify risks for developing complications. Some of these are for all children and young people, and some for those 12 years and above. There was a steady improvement in the completion rate of these checks between 2004 and 2019 to 2020. However, in 2020 to 2021, the completion rate fell slightly. This is probably due to the restrictions around hospital visits during the pandemic. If you think your child may have missed any recommended checks, you can speak to your diabetes team to make sure they are completed. The great news is that the average HbA1c keeps improving across England and Wales, despite the disruptions to care. This reduces the risk of diabetes-related health problems in the future. The NPDA also invited all children and young people living with diabetes in England and Wales and their parents or carers to complete a survey on their experience of the care they received in 2021. This is known as a patient or parent experience measure. The national report was published in September 2022. Over 4,100, or roughly 1/7 of children and young people living with diabetes in England and Wales, and over 6,700 parents and carers completed a survey. The report shows that the children and young people with diabetes and the parents and carers were very happy with their diabetes care in general, even with the COVID-19 restrictions. Similarly to previous results of the survey from 2019, over 80% of people who took part said that they always had a positive relationship with their diabetes team, and about 90% would recommend their clinic to friends or family. Despite the pandemic, nearly 90% of respondents had a face-to-face appointment during the study period, and the value of maintaining face-to-face appointments was a strong theme in their comments. Areas for improvement included that only half, 46.9%, of parents and carers said that they always received enough information on preparing and giving glucagon, a medicine to treat severe hypos, similarly to the last time we reported. While most people agreed that they were given enough information on a range of diabetes-related topics, about 1/3 indicated that they needed more information about transitioning to adult diabetes services, exercise, and diabetes-related technologies. And just over 1/5 agreed that they were provided with opportunities for peer support. If you want to see how your clinic performed against others in England and Wales, and what other families have said about the care they have received, you can view your clinic's report on the RCPCH NPDA website. And to compare your clinic on diabetes outcomes and health check measures, visit npda-results.rcpch.ac.uk. Finally, the NPDA would like to give huge thanks to all the families who supported improvements to the care they receive by completing the survey, and all the children's diabetes teams who took the time to promote it. Together, we really can make care even better.